You'll know when you have a wild woman. She'll practice her craft without boundaries. She is truly autonomous. Her loyalty is only to the family she serves, a midwife who will not allow herself to be held back by a system she didn't create.
This podcast is for the birth keepers who want to grow and change. We are open to learning through self-reflection and supportive community. We are creating this space to explore without judgment. We are remembering we were
Born wild. Hi, and welcome back to the Born Wild podcast. We're your hosts, Sophia,
Emma,
and Leah.
And I'm the most peppy tonight.
Yep. I got all my yayas out earlier doing TikTok dances with my daughter.
There you go. So that's your update for the week. Tell us.
Oh, dude. Okay, so when I was a kid, we'd have sleepovers and just like spend the whole night like choreographing a dance and then do it for our parents. And that was like the big reveal. And now this generation, my daughter's 11, it's like, no, you have to like learn somebody else's choreography, do it to a T. You can't like have your own thing. And then you have to show the entire world or else it didn't happen. And so it's I'm like, oh, this is, yeah. But it was actually really fun. And it was a good bonding experience. And we did this one reel on Instagram where you like change your outfit. You have to change your outfit like so many times because it's just like one hit. And it took like 4 hours. I'm like, I have so many things I need to do. And I'm just spending my day like changing outfits and doing this reel with you. But she's going to remember that for the rest of her life. So
it was amazing. It was super good.
So much. Like, I have respect for people that do those because it's like it's an investment of time to do a video like that.
And I guess remember doing it every day, right? Because then there goes your week.
For sure. If you're getting paid. Yeah. But I got
it reminded me of doing
my friends.
The choreographed dance to like Janet Jackson.
Mm-hmm.
Where we do that at sleepovers, and it was like, I don't know, for the parents or I don't know. I feel old when I talk about it because
it was
everything goes on the internet now.
Madonna, it's amazing. Ours was to Madonna.
Mm-hmm.
Nice.
Like a fan.
Yeah. Well,
what's your update, Leah?
So I had this interesting week. I have a new mama, a new client, and it's bringing up this idea of like everything is within normal range for her. It's on the edge, but it's within normal range. And the midwife that she was working with wasn't comfortable because it was on the higher end of normal. And I can feel it in myself getting uncomfortable with it getting close. And I think about you, Sophia, and the reminder of the range of normal. It's like, when you get close to 42 weeks, we're already calling someone late. When they're not late, it's within normal. So like just sitting in that space and really saying to ourselves, like, even though it's close and people get upset in the medical model, it's not actually outside of normal. So that's been interesting. That's been a lot of like this week's lesson for me is working with this new family around that. And then I also covered for a friend who's a doula in the hospital, which I'll talk more about in a little bit. But it was a good week. Different thoughts coming up around normalcy, and then the opposite of that in the hospital.
Mm-hmm. When you said that, my first thought was to a past client of mine who measured small for dates all of a sudden. And off the top of my head, at like 38 weeks, she was measuring 37 weeks. She was always right on it. But at 39 weeks, all of a sudden she was measuring 32 weeks, which is, a huge shift. It could be fluid, it could be baby dropped, all these different things. She had a previous IUGR baby. So it was just a conversation that we talked about, and all the things that could cause her to be measuring smaller this week. And then just encouraged her to like check in with herself and see if she feels like everything's good, or if she feels like something's off, or if she wants to dig farther and see, if there's anything going on with the baby, if she's feeling unsure and wants more information. And she was like, oh, no, 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 everything's fine. This baby's got a huge butt and this baby's fine. This baby's feet are huge. And she did have huge feet. But she was like, oh, my baby's fine. And her baby came, I don't know, like 4 days later or something like that. And, just under 7 pounds. And waters broke in the pool right before the baby was born. So I don't know how much fluid there was, but yeah, just when I saw she was measuring 32 weeks, it took not my breath away, but just like, where is this gonna go? Like, where is this gonna go? And I was so grateful for her feeling so connected to her intuition to be so sure that her baby's okay, and she had this beautiful home.
Was this, I feel like I know, I was at this birth, her baby was posterior, right? And slid out like no issue.
Yeah. Though
so maybe that was part of the
like,
measurement.
She was in labor for like 2 days, but early labor. Yeah. Well, I didn't do my check-in, so I'll do my check-in real quick. I just had a week of taking care of sick babies. Basically, that was my week. We had a very busy week before, birthday parties, lots of birthday parties, and sugar and cake, and my son licked a couple bowling balls, and it was inevitable that somebody was going to catch something. So he started to not feel good, and he had a little fever, and then my daughter had a little fever, and they all got the snotty noses and the coughs, and then like 2 nights in, I was thinking, oh God, am I just worn from taking care of sick kids, or am I starting to get sick? And so I went to bed early, and then I felt fine the next day. But inevitably I got like a little sore throat and just feeling like really drained. And so we just kind of canceled our whole week and just hung around at the house and took tons of everything to get better. And we all feel great now. So it was kind of a blah week for me. Yeah.
I'm glad you're feeling better though.
Yeah, me too. Yeah, it was like the perfect week, actually. It was easy to rearrange all the things I had to rearrange, so it was perfect. Destiny. What are we going to talk about today?
I forget. Well, I know. I'm having quiet voice time. So I know we can't talk about it maybe, but I went for a hike today, and I was listening to the Free Birth podcast. And maybe, I don't know, we should space this out, but I guess having not done a hospital birth, should we pause, Sophia, so we can edit, or how do you want to do it?
Yeah, let's keep rolling.
Okay. Yeah, I just haven't done a hospital birth for a while. It's interesting because it seems like there's a correlation between being present at births and not actually touching any woman's vagina. Like, I feel like it's been a while, like that you and I haven't actually, no, I mean, like, we don't do exams and we haven't really caught anyone's baby for a while, right?
Yeah.
So as midwives, I just haven't.
I just laughing. You could be like, it's been a while since I've touched a vagina.
Right? No, but yeah. It seems like it's supposed to be this core part of being a midwife, but honestly, practicing the way that I really want to and the way that we do, I just don't end up doing that. very much. And then seeing the correlation between that and not transferring, you know? But so being at the hospital after not having been there for a long time and just observing someone who had this, you know, birth plan of wanting to essentially not be at the hospital, but give birth there.
Yeah.
And be in a place where all of the options that are there, they are not interested in. And why you would go to a place where you don't want any of the things that they offer, and you have to work hard to decline all of them. And then, but you want to be there just in case, but the things that are there are what causes the scenario where you need the just in case care.
You realize they don't really need a doula, they need a lawyer is what they're looking for.
Well, it's just, I mean, it's like this, and it's the same thing at home where, you know, and I found that this really is getting less and less, but clients that I've had where they really want a hospital birth at home. Like they want to have the same type of care and interventions and the just in case card and all of that, but they want it at home. And it's like, it doesn't work that way.
Yeah. I remember when I was doing doula work, I would ask them, because you want to know what they do and don't want, and they start telling you their plan, and you're thinking in your head, wait, why aren't you doing this at home? Like, don't do this, don't touch me, don't touch the baby, don't, you know, and it's like, okay, wait, what do you want from them? And they're like, I want them to be there just for emergencies. And I think the feeling people have is that, what if there's not enough time to get there? You know, like if you're at home, like what if there's not enough time? And really, like if you think back, Leah, the last few emergencies or transfers or anything like that that we've had to do, like even the baby that ended up needing a blood transfusion, like there was time, you know, that baby. Do you know what baby I'm talking about that needed blood?
No.
Placental abruption.
Oh, I didn't know she needed a transfusion.
Yeah. And it's like, we still had plenty of time and the baby was still fine and we were breathing for the baby. And it was just clear that when we stopped breathing for the baby was, you know, not doing okay. And so we breathe and then she came around, but we're like, okay, we can't do this forever. We got to go in, you know, obviously she needs something else. And it took them a little while to even figure out, you know, until her labs came back and they were like, she needs blood. So, and then everything turned around for her. But so a lot of the times too, the emergencies, even there's time to have conversation. There's time to talk about it, you know, explain things. One of my pet peeves too in emergencies, wherever you're at, but especially at home, is when midwives start yelling at the mom when there's an emergency. Like it almost feels like she's in their way, and it bugs me so much. Like, why can't you
like the mom is in the midwife's way?
Yeah, thinking specifically about like some shoulder dystocias I've been to, and how midwives, or even seeing videos online where the midwives start barking orders at the mom, you know, instead of being like, you know, I think your baby's a little stuck, and if you move your leg this way, you know, like this feeling of working together, they start going like, I need you on your hands and knees, you need to push now. And, you know, and it's just like, oh my God, how is that? Like I can just imagine all the adrenaline and the tension and like, how is that going to facilitate getting this baby out, you know? And it feels like
it immediately pulls you out of the labor zone. Like it just floods you with adrenaline, like you said.
Yeah.
You know, and freezes up your body.
Yeah. And it makes it feel like, as an outsider, when I'm watching this either in person or on video, it makes it feel like this midwife is trying to save the baby and the mom's not cooperating, is how it feels when she starts yelling at her, you know? And it's like, come on, you don't need to scare her into doing this. You don't need to be like, and it's obviously the midwife's fear coming out is how I take it.
Totally. you were a doula, Emma, right? Before you were a student,
Yeah.
or no? Yeah.
Mhm.
How long were
Yeah.
you a doula?
5 years.
5 years. That's a long time.
Mm-hmm.
You're like,
Yeah,
yeah.
I was working for a doula agency. Um, yeah, so I would basically, she would give me the mission and I'd go out on, it felt very like the whole agency thing was very interesting because my clients weren't picking me. They were just, I was just the one that would show up and meet with them. So it was very interesting. There was a lot of people I'm like, oh, you probably would not have chose me. But, and some really great relationships that I still have.
Mm-hmm. Have you ever been present for a dystocia?
No, not in the hospital.
At home?
I've seen a dystocia at home, but not at the hospital. And I mean, maybe I had, and I just didn't know what I was seeing. You know, I've seen some pretty violent births at the hospital with forceps and things. And so that might have been them trying to deal with the dystocia. And I just didn't know that was what was going on. Mm-hmm. It'll be very interesting going back as a doula, knowing what I know now. I feel like it's almost kind of like I don't think I could go back. I don't know. I have a doula client who's having a hospital birth and she's like, yeah, I just want all the things. But I just don't know. I don't know if I can be the doula that I used to be, where I was just kind of letting things roll off.
Too much.
Yeah.
Well, the definition in the hospital of a dystocia, like when they chart it, is doing a maneuver. So whether or not it's necessary, if they do McRoberts, if they, anything, corkscrew, any type of, or suprapubic pressure, anything that they do, whether or not it's needed, that categorizes it as a dystocia, which goes in their, patient's chart. And then forever, Sophia, the client that you had that had that history, in their chart, they're a dystocia and they're high risk and they should have a C-section the next time, and all of that. But yeah, it's so frustrating because I feel like in the hospital people get labeled dystocia, but the situation is created where they have to do maneuvers with the epidural and with positioning. So I don't know. Sophia, have we done a dystocia together? Because I've done them and I feel like you've done them, but I don't know if we've had one together.
Not together.
No.
Yeah, the dystocia that I saw, we had the mama go into a running start and it was like easily handled. But I'm like, God, being on your back, like with an epidural, yeah, McRoberts, but like, whoa, like, how do you, that just seems so intense.
Yeah, it's more dangerous, if the mama can't move. Yeah.
Oh, yeah, for sure.
Yeah.
Yeah.
Yeah, the mom who came to me and she had been told she had a dystocia with her first and was trying to figure out if, home birth was right for her. That was one of the things that we talked about, was how, she had been induced and she was laying on her back, and that none of those situations would happen at home. So even if she had an amazing birth and wanted it to happen exactly the same way, it's not possible, because it's going to be different, because she's going to have mobility and we're not going to, force the baby out. And I can't remember how long her labor was, like 4 hours or something. And yeah, they were getting ready, with the second, they were wanting to sign her up for her C-section, and her baby was 3 pounds less than the first one.
Wow. Yeah.
And came out super, super smooth, super straightforward. So just like sad to think that she could have had that taken from her if she had played into their fear, instead of trusting herself, because she did wobble, or like her faith in herself wavered a couple times every time she'd go in and talk to somebody, which is a whole other topic that we've been wanting to do about hospital systems and providers feeling like bullies. And I say hospitals just because I think it's more common that if I'm working with someone that they might also have a hospital provider they're working with. Though I'm sure people could say the same about some home birth midwives or birth center midwives. It's not just hospitals, but yeah, when your provider feels like they know better than you, I think that that's a bully. Because it's not, it can't be true.
You and I had this conversation, Sophia. I think it was actually driving to Emma's house. And I because it's actually one of my newer clients, a conversation that I had is this idea that in the past, when mamas had concurrent care, right, especially transferred from, classic OB or just practice that was hospital based, that they would continue to do care with that provider as well as us, because why not? And it's one thing when their insurance only will cut, like Kaiser, where it will only cover Kaiser labs and ultrasounds, but outside of that, just continuing to see their provider, and this whole thing of like, oh, they don't know I'm having a home birth yet, and how do I tell them? And coming to a place where I'm sort of like, okay, you're choosing to want midwifery care and to not want the interventions and the mentality of the traditional OB system. But if you're going to continue to see them, even in addition to seeing me, that's what you're going to get. So if like the goal is to not be in a place of fear based on the emergency mentality of OBs, if you keep going to see them, even if it's like, again, concurrent with my care, that's what you're going to get. So having this conversation with someone, and it's really important to me, choice regardless of care is super important. So I wouldn't say to a woman personally like, oh, I won't work with you, but I just explained it that way. Like, why would you continue to be in a system that's going to make you stressed out and is going to find whatever could be wrong? And again, returning to that thing of you're in the range of normal, but you could be getting close to outside of it. So we're going to produce all this fear in you. Why would you want to continue to do that? And she stopped, and again, it's not about saying you can't do this, because then you're just reflecting what the other side is doing, but actually having a communication with someone that's very straightforward and pointing things out, and then they realize they're like, oh, okay, actually, yeah, why would I hire a midwife and then continue to get this medicalized care that I'm not wanting? Sorry, that was a little bit of a rant.
No,
No.
Yeah, it feels
just a
kind of
newer part of my practice where I feel more strongly about that. Like, why am I setting up this care when someone's going to go in and still get that fear-based feedback that I just have to, we have to process again.
Yeah.
Yeah, I see it time and again too. Even if they are supportive up front, the farther along she gets, the less. I had a client who she was, very straightforward with the people that she was seeing, and they were like, yes, we won't. She was like, I don't even want to talk about induction until 42 weeks, like, just don't even bring it up. I know all the options, And they were like, yep, no problem at all, totally fine. And then she went in like the day after her due date, and they're like, okay, we got you a bed over at Labor and Delivery. She went in for a non-stress test. And she had, this was like her third non-stress test or something. She had gone in a few times. And she was like, is everything okay with the non-stress test? They're like, yeah, everything looks great. And we've got you a bed ready for your induction. And she's like, absolutely not. And she called me after and was like, I just did so much work in therapy. And yesterday I felt incredible and like so ready for this. And now I feel like I'm wavering again,
Yeah.
and I wasn't like that until I, went in there. Um, and now she's starting to feel like, do I need to do something? Should I encourage the baby to come? When the day before she was not feeling that way. And she had her baby the next day. Um, so at home, and it was beautiful and it was fine. But yeah, I just see it time and again that eventually, if you don't have your baby soon enough for them, they will turn on you.
Mm-hmm. Yeah, taking away your agency.
Yeah, and just scaring you. I mean, we all saw it with that one family who decided to have a home birth at the last minute and went in just to let their care provider know their plan. And
Oh, yeah.
and were sent by ambulance to the hospital for strange heart tones. They weren't even sure what they were seeing. And by the time the dad got there, they were prepping her for surgery, and he put a stop to it. Was like, have you even listened to the baby? No, they hadn't. So they listened to the baby for 2 hours and sent her home. But there was just like so much fear around all that they decided not to have a home birth. When in my head, I was thinking, well, everything felt fine until you went in, you know.
Mm-hmm.
But everyone has their own journey.
Right.
But yeah, and this was with a hospital midwife who has had home births and I thought was really supportive. I even told her, oh, you could totally tell her. She's super supportive. But she is clearly not supportive of VBAC at home. Because
I mean, it just takes like the tiniest little ounce of fear on the client's part, or like just being unsure because they've never had a home birth or they've never had a baby, to just kind of tilt that, be more in that system. And that's why we see so many more mamas wanting to have a home birth, to heal from the experience that they didn't even want to have with their first baby.
Exactly. Yeah. Leah actually has a fair number of first-time mamas. When we do our statistics, she's always got a lot of first-time families. That's awesome.
Yeah. I was just gonna say, I'm finding more and more with my practice, which feels awesome. But it's, I feel like it's definitely been a process that has had scary moments, but just remembering ways that I used to feel like I was beating the system, like we were talking about induction and having clients who would go in for NSTs and just, taking this breath and assuming that they were going to go in and get pressured for induction. And this is like 40 weeks and 2 days or something. Everything seems great, but they're like, oh, we have a bed already made for you, like we're ready for you. And I would tell people, okay, if you're there, decline, but schedule an induction date. Like just let them schedule one. They'll get off your back. You don't have to go in, but just schedule one. And after a number of years, I just feel in this place, like in my integrity, why do we have to lie? Or why do we have to feed into their system? Like just say no and walk away. And it's hard, because in some ways, like we want the reassurance of the non-stress test, but then we have to placate them and be, and say to them we'll be part of their system, even though we don't have the intention to.
Because unless you need help at the hospital, walking in is dangerous. I mean, I experienced that firsthand. I think I told the story, but I was a student midwife, felt very educated, had 2 midwives with me, and I ended up in a cesarean that almost killed my baby. And I didn't need it. I needed it at the time, but being in the hospital is what caused the issues in the first place. So it's not as simple as like, I don't see it anymore as simple as like, oh, just go in and say XYZ to get them off your back. It's like now I want to be like, go in at your own risk. It could make or break
Mm,
anything. They can change
mhm.
your mindset. They can, encourage you to do something physically, like, just sweep your membranes and now your water's broken. And, you just don't know. And I am grateful for the hospital system. Both my babies needed the hospital system, but it's really dangerous to go in if you don't need it.
Mhm.
Yeah. Well, and it's almost just like having because some people, home birth is not what they want. It's not their choice, and that's fine. I do, like I said, really strongly believe in choice. Um, but to go in, thinking that you're going to have a birth that's like a home birth, or transferring from a home birth because you think, okay, I can continue what's happening, but have this little bit of intervention. It's like, no, you walk in and you have a different birth.
Mhm.
Mhm.
And sometimes you need that. We all know that medical intervention can be life-saving, but most of the time you're entering a different world, and just keeping that in mind and being honest with women as midwives, that's what that entails. And I feel like, Sophia, you and I have been at births where hardly ever people want to transfer for pain management. Like, I can't actually remember the last time somebody purely for pain management wanted to transfer. But when we've had other instances, as soon as we explain to them the process of going, and this is not emergent situations, which is 99.9%. But when we explain, like, this is the process of going, and this is how your birth will change, they change their mind, and we're not trying to talk them out of it so much as we're giving them the reality of the situation.
Well, most of the time too, when they're asking, like when I have a woman who's, asking for an epidural or to go in, which I actually can't even picture that happening. I don't think anyone said that to me, but I usually just hear this is really hard and she needs validation, or what we're doing isn't working anymore. We need to mix it up,
Mm-hmm.
you know? I think it's only happened once. I was a student midwife, and the mom didn't even want home birth in the first place. It was the dad who wanted it. I think he was born
Mm-hmm.
at home. I'm trying to remember, but he was super into it, and she was thinking, okay, well, as long as if I do want to go in, I can still choose to go in. And we were like, yeah, oh, of course, you could totally go in. And so it was like, obvious that it wasn't for her, it was for him, and so we went in, which of course we were going to go in. So that's the only time that I've ever seen that happen.
Mm-hmm.
The request for like pain medication.
Mm-hmm. Yeah, I mean, I'm sure I've had it happen. It just feels like a long time ago, or very rare.
Hmm.
I just, I don't think that labor is unmanageable. I think it's unmanageable in the hospital
Hmm. Yeah,
a
that's
lot of the time.
harder. Yeah.
Mhm.
Yeah. And the thing that really irks me is the whole your baby will die card. That they like
Mhm.
literally, it's not even like metaphorically where they beat around the bush. That the mama who was in for the non-stress test, and they were like, we have a bed ready for you. And she was saying,
Mhm.
oh, but I'm, having a home birth. And we decided we weren't going to talk about induction until 42 weeks. And they actually said, we can't guarantee that your baby won't die before, you go into labor. And she's like,
That's so
but
crazy.
that's what I'm coming in for the non-stress test, right? Like
Right. And they can't say that
Mhm.
regardless.
yeah.
Right.
And like it looked fine and everything. And of course, we know the non-stress test can't save your baby from dying. Like nothing can.
Mhm.
You can do all the things, and something could still happen. But yeah, she was just like,
Right.
Did they actually say that to me? Oh, I was so floored. Yeah.
I think what I've always found interesting is going in for non-stress tests and having both of them be exactly the same, like heart rate, great, AFI, totally fine. And having one provider tell you that, like, the increased risk of stillbirth and all of this stuff, and like all of this fear instilled, and this idea of like, walk through the gates to this, hospital room with an induction and you'll be fine. And then also having essentially the same outcome as far as like what the test results saying, and having a doctor say like, yeah, go home and have a wonderful home birth.
Yeah.
It's less common, right? The second thing, but I've totally had it happen. And so, it's the same thing where I've transferred for, a heart rate that's not terrible, but it felt not reassuring. And we talked with the mom and she wanted to go in, and we get there and it's like 20 minutes before the heart rate monitor goes on. It's just so interesting how the emergency turns into like not an emergency.
Yeah, we'll get
there.
Yeah.
Totally.
Yeah. It's so interesting too how one family could have this whirlwind, like the cascade of intervention with their first, and take that and say to themselves, thank God I was in the hospital. Me or my baby could have died or whatever. And then another family could have, a very similar experience and take that and recognize that this happened because I was in the hospital, white knight coming in to save the day when they actually caused the issue in the first place.
Right.
Yeah, it's always interesting to see who lands where.
Oh yeah. Yeah, I know. That's why I don't know if I can continue to be a doula, because it's really difficult for me to sit with people that are, trying to remove my thing out of it, but just like looking at the bigger picture, and they are so thankful that they were there. And I know that that's why those things happened. And so it's challenging to not put my thing on it when they're really happy with their birth and happy that they were there.
Yeah.
So Emma, when you think about in the future having your own practice or working with a group, whatever it is, but being a a practicing midwife, how do you feel about doing concurrent care, about working with someone that also sees an OB or even a nurse midwife? I mean, I know that you're still learning and figuring all of that out, but right now with the experience that you've had, what are your thoughts on that? Or what do you feel like you would want to do as a midwife?
Yeah, I mean, I think it depends on where I'm living. Like, I live in a really rural area where if they are doing concurrent care, like, we know the OBs really well and we work really well together. I think that's a huge part of it. If you have rapport with the people that you're working with versus not knowing them, or if they're more against home birth, like, that can really make a difference. And it's like really not up to me, right? Like, if they want to do that, they're doing that, and you either have them continue care with you or not, right?
Right.
I don't know.
It's my new rule. Because I'm like, you have 1 foot out the door. You might as well just keep walking.
For sure. Yeah.
Like,
I mean,
like as of like 3 weeks ago, I've decided that.
Yeah, I think you've also like built up your practice enough to be able to make that choice. I think as a starting midwife, fresh and green and looking for clients, I would be like, sure. I don't know.
I think it's the reason doula clients. It's like,
for sure.
You got to take it where you can get it, kind of thing.
Yeah, I mean, I think it would make our, the job, like Leah was saying about having to process things that you've already processed because they're coming back up, and everything that they're saying, they're asking you about, and like, what do you think about that? And then, You don't want to like give your own opinion, but you want to like give them, you know, informed choice. And yeah, I mean, it's definitely not ideal. But I don't know.
I think there's a way in the beginning where you kind of take everything, at least I did, doula work, Montrese work, collaborative care, you know, all those kinds of things. So that way you can learn from your experiences and kind of weed out what isn't working for you.
Totally. Yeah. Yeah.
Yeah. And it gets your name out into the world, and then you can kind of funnel yourself into what your ideal client is over time.
Yeah, for sure. Yeah. I don't know if we're allowed to, are we allowed to just like talk about like public figures on the pod? I mean, I guess she's a public, yeah, she is in our world.
Do it.
Over it. Okay. I was just
We'll find out.
We'll find out. I was so impressed or just inspired by watching Maren Green have her, like, she had to, I think she planned that she needed to go to the hospital with one of her babies, and she just like completely took her power in that experience, and like the nurses were just like standing there like watching her kind of in awe, like she just like owned the space, and it was so freaking badass to see. Like, damn, that's awesome. I think she had to transport, but yeah, no, it was very interesting to watch just like somebody really, a midwife, like in the hospital setting, like just calling the shots. It's very cool.
Right. And that goes back to choice in the sense of like, if you're home and you feel intuitively or whatever's going on, like, okay, I want the interventions that the hospital has to offer, like, rock it, take it, you know. I think it's going in, I think I know the birth you're talking about. You know, but going in thinking that you're going to get something else. And I was going to say, Sophia, I feel like you and I have had this difference in our client group and just conversation before about working with people who, I wouldn't say so much that I no longer will work with people that will do concurrent care, but that by the point that we're really in a flow, they understand and they don't want to.
Yeah.
I think maybe because I've worked with more people in the city or people that are a little bit more mainstream or like new to the concept, it's like it takes them a little while. Like, it's a leap for them to even consider using a midwife. It's a leap for them to consider doing a home birth, and they get there, you know, the more information and empowerment and all of that they have, but they have to start somewhere, you know. So that transition into, I don't know, just understanding, you know, the difference between that and just saying like, I won't work with someone that does concurrent care.
Yeah, because that's where I'm at.
Totally. No, and that's, you know, there have been multiple topics where you're just like, yeah, no.
And I love you for that, Sophia. I love you for that.
No, totally.
You're so like in your just like boundaries, which is great. I think starting out, I'm like, you know, going to be the midwife that just meets you where you're at. I don't know.
Yeah. And I think we all start there, you know, and then because everybody has their own boundaries. Like, some people might feel like, you know, collaborative care is exactly what they want and they actually prefer it, and it makes them feel safer as a midwife, and, you know, all these things, and it makes me feel the opposite, you know. And yeah. So yeah, I think we figure out where our boundaries are, and if it's a hard stop or if it's like, well, it's not my preference, but it's fine, you know. Yeah.
It also just feels like I want to feel secure as the practitioner, and it feels like they're going to get like other information, and then like I'm having to like prove myself or like my skill. Does that even make sense? Like,
Totally.
like that just feels like that would give me a little bit of anxiety if they're going to their provider and then coming back and like not so sure themselves. Like you just have to be really sure and clear as a practitioner, which I mean, once I'm licensed, I hope that I will be, but I don't like that feeling of like having to prove yourself like over and over again.
Yeah. And I think the whole point of my care is to keep giving her power back to her. Even in the sense that, she's, that I'm not telling her how something should be. And so just to send her to someone else who for sure is doing that feels not really helpful.
Or like you're just having to talk them into it, like having the home birth. I don't know.
Or just
Like,
that
that's never going to work out.
Or just they're continuously going outside themselves for reassurance. When the whole point I'm trying to do is to keep sending her inward. But then when she leaves my appointment, she keeps turning to somebody else going, am I okay? Is my baby okay? Kind of thing. And for that, because I think the whole prenatal point for me is tuning her into her intuition so she can look at me and say something's not right, and like that's what I'm counting on, but she knows.
It's like that genuine trust.
Right. For sure. This is why building trust and solid prenatal care is so important.
Yeah. Well, this was a good topic. I like when we don't pick ahead of time and we just kind of see what happens.
Yeah.
Oh.
Yeah.
Definitely. I know. I'm like, it's all coming into my brain.
Cool.
Well, it might be time to check out, but all I will say is that this is sort of where it goes back to there's a midwife for every family. And, I think that there are some families that need some time to come to that space of like, I don't need this reassurance. And, I feel like for me, it's what happens is that, like you said, Sophia, they're supportive, everything's good until like 36 weeks or so when it starts to get close to the birth. And then, the medical model really takes over regardless of what their provider has said. So for me, my new sort of line is like that space, and I know for you, it's like regardless.
Yeah.
So it's, it's again, one of those things where I feel like we have a similar belief about it, but just different people needing different things. And I love, Emma, that you're in a space where you're just learning and you don't know yet.
Because I think it takes all
I'm like, I'll meet you where you're at, I'll take anyone.
Right. Well, that's right.
But it takes all experiences to like fine tune who you are,
Totally.
Yeah, because I have like all these stories now of when I got screwed because of some other care provider. And it's like, that's what shaped this like fire inside me. If I didn't have those experiences, I'd be like, oh, it's been fine. Yeah, you can go ahead and see somebody else. We'll just do, collaborative care, no big deal. But like these stories that I have is what is shaping the boundary, and you wouldn't have that boundary because you don't have those stories yet, hopefully not yet, but we'll just see what your experiences are and how they twist and turn you.
Yeah, I know. I love that. It's beautiful. Can't wait.
Cool. We should wrap it up. It was great seeing you ladies. We had to schedule last week because my household was sick. So we're recording on Zoom. We hope the sound quality isn't too crazy.
I feel like so much has happened since I've seen you guys. It's been a long time.
Yeah.
Leah's
A week and a
Alright.
half is a long time in the birth world.
It is.
and Leah's a whole nother year older. Happy birthday.
Oh my
Yeah,
goodness, yes.
Happy birthday, Leah.
Thank you.
Mm.
I'm gonna go have some pizza
Enjoy.
Okay.
with some
Enjoy.
other things that are happening.
I saw that background.
on the podcast.
Yeah.
Should we
get it.
close up with anything else?
Final thoughts are surround yourself with people who believe in you.
Mm.
Yes.
I
Both
love
feet
that.
inside. Nothing out the door.
Love you guys.
Yeah.
All right. Love
Love
you
you.
guys. Bye.
Thanks everybody for listening. You can find us at Born Wild Podcast on Instagram. For inquiries or feedback, you can email us at bornwildpodcast@gmail.com. You can find me, Emma Ray, on Instagram at Emma Ray, REA. Sophia at sophiabirth.com.
And me, Leah, at Bay Area Home Birth.
We would really appreciate it if you would rate and review us on Apple Podcasts. It helps us reach more people. And as always, stay wild.